Hey, hi, welcome back. So, in the first segment or in the first video of this video series, we understood the business model of a non-life insurer, of a general insurer. We understood the business model as to how a general insurer or non-life insurer, how they make money. Okay, so that was video one. That was segment one. Segment two, which was video two, we we quickly analyze Niva Bupa, okay, and we compare it with its peers, Star Health and Care Health. All right. And this video is segment three, in which we would estimate the market size of retail, retail and group health insurance segment in India. Right. So let's get started. All right. So in this third segment of the video, we'll estimate the market size of both retail and group health insurance business segments. All right. So we'll do that is essentially first we look at how many lives are covered by both retail and group. All right. Group segments. Okay. And how many of these lives would be covered, let's say 10 years out. Okay. So we'll make projections. Okay. कि कितने lives अभी covered हैं और कितने lives कितनी जिंदगियां by these insurance, retail and group insurance can be covered, let's say 10 years out, and number of lives covered times the premium, okay, per insured person will give the total premium. Okay, for both retail and for group. All right. So let's estimate the size of the both retail and group together. All right. Okay. So let's do that. All right. See, this is the income pyramid that I pulled from the RHP. Okay. And I found it very useful. Okay. So this is the income pyramid. So if you look at 2018, if you look at the four slabs making up the pyramid, the bottom slab says low income households. So this 139 million or 13.9 CR is the number of low income households making less than 3 lakh rupees per annum. Then the slab above it, it has around 9.3 CR people. Okay. So which who are making it's 9.3 CR households rather making a household income of between 3 and 8 lakh. And then above the slab is 5 CR people making an annual household income of between 8 to 11 lakhs. And uske upar 2.8 CR people making an annual household income of above 11 lakhs. So this is how the income pyramid looked like back in 2018. In 2013, okay, of course, you see okay, the number of people at the bottom, the number of households in the bottom of the pyramid, it reduced. Okay, and a lot of households they were pushed in the upper income bracket. Okay, in 2018, like 5 years out, the income pyramid is poised to invert. Okay, as per many research firms. Okay, all right, the income pyramid not only from this Red Seer research firm, but many other research firms are predicting that the income pyramid in India will invert. That is, the bottom slab, okay, will reduce significantly. A lot of people will be lifted out of poverty. A lot of households will be lifted out of poverty, and a lot of households will become prosperous. Okay? So that's what this income pyramid is telling us. Okay? And if you look at the first three slabs, okay, okay, which are the lower middle, the households, lower middle and above households, lower middle, upper middle, and high income households, these first three slabs, 17 CR households were in the lower middle and above category in 2018. So the 17 CR households, it increased to 21 CR in 2013, 2023. And then it is poised to increase to 27 CR. So the lower middle and above households are poised to increase from 21 CR right now to 27 CR in 2018. Okay. And I did some back of the envelope calculations. So 10 years out, that is by 2034. Okay. The lower middle and above income households should increase from 21 CR to around 30, 32 CR. All right. Not getting into how I did that estimate because it will, because I intend to keep this short. All right. But anyways, please understand that the number of lower middle and above households would, of course, increase in the future. Okay. All right. Now let's get to the retail and group life estimate. All right. See, right now we are in 2024. In 2024, there are 144 CR people in India. That's the population. Okay. And we just saw that there are 21 CR households. There are 21 CR lower middle and above households. Okay. Lower middle and above households, there are 21 CR. But the lower middle class, upper class, all of those income brackets, they are a part of 21 CR. Okay. Now, assuming that there are four members on an average per household, so totally we come up with 84 CR people, which are a part of these lower middle and above households. All right. Okay. All right. And the number of people that are insured by retail and group lives, by retail and group insurance, number of people insured by retail and group insurance is 30% of this 84 CR. So it is around 21 CR. All right. All right. Okay. Is 30%. All right. Because only these people are likely to go for retail and group insurance. Okay. Other people who are, below lower middle, okay, they, of course, would not be able to afford retail and group insurance, right? So a portion of them would have government uh, coverage, okay, that is welfare coverage. And of course, a lot of people in India do not have insurance at all right. So any which ways, moving forward, so this 27 CR people is made up of group insurance and retail insurance. All right. So retail, number of people covered by retail insurance is around 21% of all the insured people outside of government plans. Okay. So this 27 CR people, okay, is basically all the insured people that are covered outside of government insurance plans. Okay. All right. So this 5.7 CR number is 21% of this number. All right. This is what is happening right now. Okay. Be there with me. Okay. Now we move to the projection part. This is these are numbers as of today. Okay. Now let's move forward. 10 years from now, India ka population every year would grow at 0.7% on an average every year. So the population from 144 CR people may become 154 CR people. Okay. All right. And the number of lower middle and above households, okay, may increase from 21 CR today to 32 CR 10 years from now. Okay. And again, assuming four members on an average per lower middle and above household. So totally number of people falling in these households would be 128 CR. All right. Okay. So 84 CR becomes 128 CR. Okay. All right. Now I'm taking an assumption the number of people insured outside of government plans, that is covered by retail and group insurance, number of people covered by retail and group insurance increases from 30% today, increase from 30% of these lower middle and uh, above household members today to around 35-40% 10 years from now. So this 30% becomes 35 to 40%. This is an assumption. I have it in yellow. Okay, I will come back to it. This is an assumption. All right. So number of insured people covered by retail and group insurance, okay, becomes around 45 to 48 CR people from 27 CR today. All right. Okay. All right. Now moving forward. Okay, so of course this 45-48 CR people, okay, all right, is, as I said, is composed of group insurance and retail insurance. All right. So to estimate the number of retail which make up this circle here, okay, what I do is, okay, I see that right now in 2024, retail forms 21%, okay, of all the insured people. Okay. Uh, Retail forms 21% of this number. Okay. All right. This 27 CR retail forms 21% of this number. Okay. It's around 1/5 of this number. All right. So I'm assuming that 10 years from now, retail may take a higher share. It may become 30% of all the insured people outside of government plans. So retail, this 21% may become 30% 10 years now. Again, this is an assumption. Okay. So totally people covered by retail lives, retail insurance would be 14-15 CR people. Plus, of course, there would be people covered by government, by group insurance, which was 31 CR. Okay. All right. Now, let's try to, of course, I took these two blanket assumptions. Okay. We need to see if, we need to check if these assumptions, they are reasonable. Of course, if they should not be ridiculous. All right. Okay. So we'll validate these two assumptions, okay, using some logic. All right. Okay. So any which ways, 10 years right now, the number of people covered by retail and group lives, okay, makes around 30% of all the people falling in lower middle and above households. Okay. All right. So we are saying 30% will increase to 35, 40%. But 6 years ago, in 2018, this number was 18%. So in 2018, only 18%, the insured lives, the number of people covered by retail and group, was only 18% of the people falling in lower middle and above households. All right. Okay. Right. So don't you think if 18 increased to 30 in 6 years, okay, so this 30 may increase to like 40% 10 years from now. It may increase even more. We do not know. Okay. All right. But I'm just being conservative. All right. So 18 became 30. It may become around 40% 10 years from now. All right. Okay. So that's one way to kind of justify, to validate, if it's not like, if this assumption is reasonable. Okay. Then the other way is, uh, let me go forward. Let me validate it another way. Okay. All right. See, again, in India, as you saw, there are 144 CR people right now. Okay. Okay. Number of PAN holders in the country is around 50% of the population. Okay. PAN holders in the country is 50% of the population. Right. All right. So what it means is 3.5 people from each of the 21 CR lower middle and above households are adults and they have PAN. What it means is 3.5 people from each of the 21 CR lower middle and above households are adults and they have PAN, only because only adults can have PAN card, right? Okay. So 21 times 3.5 is 74. All right. And lower middle and above households, people falling in lower middle and above households are likely to have a PAN, right? So मैं ये कह रहा हूं कि basically जो लोग लोअर मिडिल अबव हाउसहोल्ड्स में हैं, मोटा मोटा और उन हाउसहोल्ड्स के एडल्ट के पास पैन है. ऑलराइट, दैट इज व्हाट आई एम सेइंग. ओके, नाउ 10% of the PAN holders in India right now, they pay tax. Okay, so PAN taxpayers become 7.3%, 7.3 CR. ठीक है. All right. Now let's compare कि अभी what is happening is number of people covered by retail insurance is 5.7 CR people. All right, 5.7 CR people. So if you compare 5.7 CR people who are covered by retail insurance with this number, with the number of taxpayers, uh, um, you would see that retail lives, the number of people covered by retail insurance is around 4/5 of this number, is 80% of the taxpayers, which is 7.3 CR. All right. This is just to kind of cross check. Abhi I have not completed. Okay. And of course, see, in a household, you could have one earning member. Let's say the spouse may or may not be earning, and you could have two kids. Okay. So although you just have one taxpayer, but that household, okay, may have retail insurance for all the four people in the family, although you just have one taxpayer. All right. So that's why it is not a strict apple to apple, let's say, comparison. I'm just doing this to put things in context, just to make sure my number is not ridiculous. So all I'm saying is कि 7.3 CR आपके tax payers हैं. All right. Okay. जो लोग कवर्ड है रिटेल इंश्योरेंस से वो 5.7 CR है. All right. Okay. तो ये 4/5 का रिलेशन हो गया. मतलब जो रिटेल से कवर्ड है, that is 4/5 of the taxpayers, 80% of the taxpayers. All right. Okay. मैं ये नहीं कह रहा हूं कि यही 80% की टैक्स देने वाले ही 80% retail se covered. I'm not saying that 80% of the taxpayers, of these taxpayers have a retail policy. I'm not saying that. Okay. I'm just trying to compare the two numbers. That's all I'm doing. Okay. So any which ways, this is as of today in 2024. In 2034, there will be 154 CR people. Okay. All right. And okay. So the number of lower middle and above households would increase from 21 CR to 32 CR. All right. So assuming now 3 adults per household. Of course, there would be 4 members per household. लेकिन assume कर लेते हैं कि there would be 3 adults per household. Okay. So there would be 96 CR PAN holders. Okay. 96 CR PAN holders in India 10 years from now, which is 60% of the population. And this is not a ridiculous assumption because 50% of people today are of the population today are PAN holders. So 60% of population 10 years from now may be PAN holders. So this doesn't look like outrightly ridiculous. Okay, be with me. All right. And of the PAN holders, okay, right now 10% of the PAN holders are taxpayers. All I'm saying is I'm assuming that 15% of the PAN holders 10 years from now would be taxpayers. So taxpayers, they form 10% of the PAN holders today. Okay? Taxpayers may form 15% of the PAN holders 10 years from now. So the taxpayers may increase from 7.3%, 7.3 CR today to 15 CR 10 years from now. All right. Okay. Okay. And how many, we estimated around 14 CR retail people covered with the retail insurance, right? In the previous slide, we estimated people covered. Okay. I know we had a range, but that's fine. Just I'm keeping things simple. Okay. We estimated that 14 CR people in India would be covered by retail insurance 10 years from now. Okay. All right. Okay. So this 14 CR people is around 90% of the taxpayers. This 14 CR people is around 90% of the taxpayers. Again, I am not saying that these 90% of the taxpayers will have a retail policy. I'm not saying that. I'm just merely comparing the two numbers. Key, what is the ratio between people with retail insurance and taxpayers? The ratio between people with retail insurance and taxpayers was 80%, and now that ratio changes to 90%. Okay. So, and this 90% is again doesn't look ridiculous. Okay. So I'm merely trying to validate key this 14 CR people with retail insurance 10 years from now, is it ridiculous or is it reasonable? In my view, this is reasonable. All right. Because आपके टैक्स पेयर्स इंक्रीज होंगे तो 80% से 90% अगर ये नंबर हो गया तो दिस डजंट लुक रिडिकुलस, दिस लुक्स रीजनेबल. So in a way, we have vetted our assumption.